in order for me to walk you through the inception of this application, I need to go a little back and introduce you my career as a physician. So I'm a trained neurologist, and I have been doing stroke care for many years. And while doing the stroke care, I noticed that there are so many inefficiencies in the process. So I kept thinking to myself, yes, there should be a better way of doing this. And I started talking to another neurologist colleague of mine, and we both started thinking about like how we can remove these inefficiencies in the process. A lot of the work that is done in healthcare, majority of the time, it's still a lot of manual labor, and a lot of time we're missing out on the data that needs to be collected. So we thought to ourselves, like, there should be a better way to do this, so why don't we take the initiative and do something about it? And I have my career in software development as well, so I have developed some other software. So we partnered up to work on this software, which I think is a comprehensive solution, which removes all the inefficiencies that we noticed in the process. So majority of the time what happens is when you acquire a software, the software, you have to work around the software. So you have to understand what the software does, and then you take it from there. You place your work around that software. What we did was we built the software around the physician, around the workflows. And that's where my fellow physician colleagues were very helpful, because we live and breathe the process. We know the process, so we built the software around the process, so we're not looking for workarounds all the time. Knowing the system, we had the advantage of knowing all the pain points that happen in the hospital. So all the inefficiencies in the process were our priority to remove. So we started with the first inefficiency that happens very commonly in the modern day and age, where the EMS still picks up the phone or radio and they call the hospital, and the hospital then activates the emergencies. And majority of the times they will say we are 15 minutes out, and the specialists are standing there waiting for the EMS to arrive, having no idea where the EMS is. Or they don't have any information about the patient other than patient name or some basic information. So what we try to do is we try to create a communication channel between the EMS and the staff in the hospital. So the EMS can go to our app and they can search for all the hospitals in that area that are served by MDRoute, and they can activate any type of emergency, like a code stroke or code STEMI, trauma. So any type of emergency that they're bringing in, they can activate it. And it basically takes all the manual process out of it. We have the schedules of the physicians on call for those emergencies, so it automatically routes those calls to the physicians or to whoever is responding to those emergencies. And the other inefficiency that we noticed is that now I saw the patient and I need to consult another physician. Here, because the care starts before the patient even gets here, I can activate the next team. For example, I'm a stroke physician and I see that the trauma or the stroke that's coming in would need another consultant like neuro-IR. So I can just activate the team just with one single click. And I can share all the history, that everything in the line of care that has happened so far, it actually gets transferred to the next team. So MDRoute works great for individual hospital as well as a system of hospitals or a whole community. If you need to consult another specialty or it is beyond your level of expertise, you need to send the patient to another hospital, you can initiate a transfer. You can consult if the facility who you're consulting is also on MDRoute and they're sharing their schedule with you, you can just consult a physician right away just by single click, just like your own team. And you can actually transfer all the history that you have taken so far to that physician without even having to talk to them. So we're not repeating ourselves. That eliminates a lot of inefficiency from the process. One thing that I have learned in the software business and in the healthcare business, that you cannot say that we have completed the development of a software. It's always evolving. So what we have done is we partnered up with a security company to ensure that we are in compliance with all the HIPAA controls. We are actually in the process of getting our SOC 2 audit, so all our security controls are up to date. So that is also where my experience as a user came in handy. I was part of the transition where we transitioned from paper chart to the EMR, and I could see the frustrations that happen with the physicians and with all the providers and all the users. So keeping that in mind, we try to make it as user-friendly as possible. It's all role-based, so everybody's seeing what they need to see, and it's built around their workflows. So it makes it very easy for the users to adapt to what the software does. So we have a robust team of QA engineers that have thoroughly tested the product. They have experience in developing healthcare products. So we have done all our internal quality testing. And now we are in the process of teaming up with certain hospitals and health systems to beta test the product. So we will beta test at a shorter scale. And once we have determined that the product is solid and we have some data to prove the efficiencies that this provides, we will roll it out to the real world. The platform is built to scale. So when we were designing the platform, the architecture of platform is built to scale that it can be used for all across the world, not just in United States. So that is our idea. And we are actually this is backed by a big team of software development, and we are going to make continuous improvement depending upon the needs of the healthcare industry. We're going to continuously evolve this and eventually bring some AI features into it as well. This is developed by physicians, so the physicians, whoever sees it, they'll love it because it's built around their workflow. So every time we're presenting the concept of MDRoute or show the product to any healthcare system or the clinicians, they really love it. They absolutely love it. They know that this is a product that they need. And even though people are not out there looking for something like that, maybe because they don't know if something like that exists, but once we present the idea, everybody is like, I want in on it. So there are multiple products out there in market that help with the communication. There are even products for EMS, where EMS can activate the emergencies and bring the emergencies in and activate in-house teams. What we focused on and what makes it unique is there is not a single product out there that is so comprehensive that it offers all the features that we do. We focus heavily on quality. There is not a product out there that does that. We do automated reporting, root cause analysis, and there is not a product out there that does it. Same thing, we provide real-time ETAs, and that is what makes us distinct from rest of from our competitors. As I mentioned previously in a previous question, that we are partnering up with some facilities to do the beta testing, and I think we would be able to prove how our product is not only better than anything else in the market, but how it improves and it removes all the inefficiencies of the processes. And this would set us apart. This would give us some data to actually prove, not just by talking, but actually backed by data, that we will be able to prove that how we remove the inefficiencies in the process and how our strong data repository is helpful in different type of reporting and root cause analysis.